You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve.
Thank you for joining us for this episode of Plug Into Health. My name is Maddie Cave. I'm a public relations specialist with Prevea Health, and today we are talking about an essential but sometimes overlooked part of protecting your long-term health, and that is primary care. In other words, having a primary doctor and scheduling appointments with them for regular health checkups. And we get it. Life can get busy, and with everything on people's to-do list, scheduling routine health appointments can sometimes seem intimidating and sometimes even get put on the back burner. But today, we're going to be sharing the 5 pillars of primary care. In other words, the top 5 reasons to make your primary care a priority in a way that will keep you doing the things you love, not keep you from them. So to help us do that, we are here today with Erin Choate, who is the Director of Front-End Revenue Operations at Prevea, as well as Dr. Nguyen, a family medicine physician at the Prevea East De Pere Health Center. So Erin, would you like to introduce yourself and maybe explain a little bit about your role to all the listeners?
Great. Sure. Thanks for having me. I support our call teams, registration, and scheduling teams for all of our Prevea clinic locations.
Awesome. Thank you. And Dr. Nguyen, would you introduce yourself and also maybe briefly talk a little bit about what primary care covers, what your specialty covers?
Yeah. So I'm Dr. Nguyen. I am a family medicine physician here at Prevea. Started about a year and a half ago. But I hold a couple different hats. One, my main role is the family physician, but I also hold a role as faculty over at the residency clinic at East Mason. But what primary care encompasses is basically an umbrella term for family medicine, internal medicine, pediatrics, basically all the specialties that don't really have a true specialty. It's something that they have to have a broad range of knowledge over different spans of specialties. So we call it as a jack of all trades, not necessarily like that special list that you think of when you think of like a cardiologist.
Sure, an expert in everything, if you will, and a little bit of everything. Well, thank you. And thank you both very much for being here. So with that, let's kind of dive into our first pillar, that primary care is easy. Finding a primary care physician or provider and making an appointment is a lot easier than a lot of people often think. So Erin, to you, what are some of the common barriers that people might think of when it comes to seeing a primary care doctor, and what has Prevea done to try and make that process easier on patients?
Yeah, so I think a lot of people can assume that it takes weeks or even months to get in and get an appointment, and that's simply not the case. So we've been really intentional on making sure that we're recruiting physicians and providers for our locations to be able to meet those needs so you can get the care when you need it. So we've recruited between family medicine, internal medicine, pediatric physicians and providers in all of our locations. So Northeast Wisconsin, the Lakeshore, so that's going to go as far north as Mountain, Wisconsin, all the way south as Oostburg. So we have a lot of providers that are here to help support patient needs, and we can get in a lot quicker than you think.
Yeah, absolutely. And is it right that Prevea has somewhere around 200 primary care physicians total?
Correct. We have quite a few.
Wow, that's awesome. And I'm just thinking another reason that people might put off scheduling an appointment is that idea that you have to jump through a lot of hoops or do a lot of paperwork to get in and be seen. So could you speak a little bit to Prevea's scheduling process?
One of the things Prevea's focused a lot on is our online scheduling to make it really easy and to find the care where you're interested in being seen at. So for example, if you go to Prevea.com and you want to go to the Manitowoc Clinic location, we have a page for that. You can search by the zip code, scroll to the bottom of that page, and you'll see the providers that practice there. You can easily schedule an appointment once you click on that provider's page. One of the other ways you can do it is you can search for a specific provider for providers in your areas or physicians in your area, and you can put in your zip code, find anybody in your area and the clinics that they're at. And it's really easy to just go in with that zip code, and that schedule appointment button is right next to that provider's bio page. So I can click on each provider's bio page and learn about them. What are some of the things that they treat? I can see a bio video from them as well, and then choose. It's really easy. Right next to them is schedule that appointment button. We also have a really great page for primary care. So if you go to our primary care page, it's family medicine, internal medicine, pediatrics, and you can just hit schedule an appointment right away. And depending on the locations you want to see or be seen at, you'll be able to see appointment availability right away after a few simple questions. We'll make sure, do you need a physical or do you need an office visit? And it's really easy to see the availability once you choose a location and a provider.
Sure. And then what about, too, like with the My Prevea app, once you're kind of set up in our system, I would imagine that scheduling appointments after that gets even easier.
Yes. So when I'm looking for a new provider, going to our website is great because that's where I'm going to learn about everyone. But once I'm established with my physician or provider, that's where we put you on the My Prevea app, and that's going to let you do a lot of different things. You can book your appointments, you can request medication refills, you can message to your provider team as well. So that's where it just gets even easier once you've been established with a primary care provider. And of course, you can always call us to schedule. So we make the phone numbers very easy to find on our website as well. And that's also what my teams can help support and get you with the right provider in the right area as well.
Awesome. Yeah, I like the being able to tap an app. That's perfect for me. And we don't want listeners to just kind of take our word for it. We've also gathered some real patient feedback to kind of show how primary care with Prevea is a lot easier than you think. And so first we have a quote from a patient at the Prevea Kohler Health Center, and they said, "Everyone was super friendly and the process of scheduling appointments was easy and stress-free." So there you have it. It's not just us. And that leads beautifully into our second pillar of primary care, quick. That primary care is quick. And of course, Prevea doctors always take their time in every appointment, and they focus on you and ensure that you get that full care. But these appointments are generally a lot faster than people assume, and they don't have to be something that totally disrupts your day. So Dr. Nguyen, Erin touched on how fast it can be to schedule an appointment and get in to get seen. Could you talk a little bit more about the structure of your typical annual checkup, and if it's something you could get accomplished, say, like on your lunch hour or after work?
Absolutely. I think the majority of annual physicals can be done between 20 to 40 minutes. That's usually what's slotted for. And it usually begins with an introduction if you've never met your primary care physician before, get to know each other, and then going through the problem questions that the patient may have first, making sure that there isn't anything that needs to be addressed acutely, if there's any other chronic conditions that we want to manage at the moment in time, and then going through medications if there aren't any. Going through refills, making sure that the medications are working appropriately. And then, of course, we want to go through all the preventative healthcare questions, which is going to be cancer screening if they're of age, vaccinations if they're due for any, making sure that they're living a healthy lifestyle, whether that's diet, exercise. All of those things can absolutely be fit into a 20 to 40-minute conversation.
Absolutely. And we even found that a lot of studies published in some internal medicine journals have shown that regular primary care visits are also associated with lower overall healthcare costs and improved mortality rates, and then better health outcomes when you do get sick. Would you agree with that?
Absolutely. I think seeing your family physician at least once a year, we can at least align our goals together, making sure that we are achieving whatever your goals are to be, whether that's for yourself, your personal life, your family life, so that we can achieve it together in the next year. Even if I only get to see you once a year, at least it's something.
Yeah. And again, just to show that we're reflecting the real experience of a patient, let's hear from another real Prevea patient. So one patient in Appleton who works with another family medicine physician named Dr. Rory Fry, that patient said this: "I have always had a positive experience at my Prevea clinic. I called in the morning and they gave me an appointment in an hour." So that's great. And we don't always want to promise that, say you're established with a physician, maybe you can't always get in to see your primary care physician that same day, but to Erin's point, we've recruited a lot of physicians to make sure that if you need to be seen, Prevea will work with you and find an available doctor to get you seen as soon as possible. So speaking of getting care fast, our third pillar, primary care, is preventative. If all goes to plan, as Dr. Nguyen said, you see your primary care doctor once a year to ensure that nothing is wrong. But sometimes something is wrong, and seeing that physician can save you time and your life if you catch something before it's too late and it really starts to disrupt your health and your life. And for men and women, there are different things that you should be getting screened for as you age. So Dr. Nguyen, could you start with telling us some common health issues that a primary care doctor might look for in women at some different age ranges?
Yeah, so obviously the genders have different anatomy, so we're looking for specific anatomy complaints or cancer screenings. So for females, we are looking for cervical cancer screening at the age of 21 and beyond. And depending on age and testing and risk factors, we may do that every 3 to 5 years. We also start looking into breast cancer screening at around age 40, depending on risk factors, again, family history, and that is done annually or biannually. If we want to jump over to males.
Yeah, absolutely.
There are less cancer screenings there, but some, especially like prostate cancer screening, we usually start at around age 50. But if we're looking at the overall, just humans in general, there are things like colon cancer screening that we want to keep an eye out on, which starts at 45. And depending on what they find can be every 3, 5, or 10 years that you repeat that.
Yeah, absolutely. And we've heard tons of great examples also from patients where someone was able to prevent a larger issue thanks to a visit with their primary care provider. So one patient said this of her internal medicine doctor. She said, "With her help, I've gotten my weight down, blood pressure is down, and my labs look very good. She might not have treated all these directly, but she pointed me in the proper direction to get it done." And I like the way she phrased that. She pointed her in the right direction. Because especially when you get a surprise diagnosis, it can be hard to navigate alone. And that's where the fourth pillar comes in, envisioning primary care as your healthcare quarterback. Your primary care doctors are a trusted central point of contact, and they really captain all aspects of a patient's care, prescribing medications, sending you to specialists, getting you the right referrals, and things like that. So Erin, first from a system level, could you speak a little bit about how primary care providers can call the plays and kind of connect patients directly and quickly to those other kinds of care they need?
Sure. I really see our primary care providers and physicians as that quarterback because they know everything to look for. So they're looking out at the entire field for you, whether it's medications or if you need to consider some lifestyle changes or who to send you to if you need more help, maybe to refer you to some specialty care. They know where you'll need to go. And that's where that special care, if you start with your primary care doctor, it might be something they could help with first, but otherwise they know where to send you if they can. And I think that speed, they can do that very quickly. That could save lives. Getting care when you need it, we know is really, really important. But we have 60 different specialties within Prevea that our providers are very closely entwined with. And so it's very easy for us to get the patients into those specialties then when they're first seen by their primary care providers.
Absolutely. And Dr. Nguyen, did you want to add anything from a doctor's perspective on that?
Yeah, I agree. I mean, the earlier that we can diagnose something, the better management we can start and quicker that we can get to the resolution of it. And I am going to be one of many doctors who will say we don't know everything, but at least we know how to get the answer and how to get you to that answer. So
Absolutely.
The sooner you get in to see us, the better.
For sure. And one story that really illustrates this comes from a patient, another Prevea family medicine patient. Dr. Shelby Van Rossum's patient said this: "Dr. Van Rossum was prompt for my appointment and thorough. We had a follow-up call the same day from her referral to ENT, which is ear, nose, and throat, and were able to make an appointment to see Dr. Oldenburg 2 working days later. I am very pleased." So yeah, wow, this patient was able to access that specialty care within just 2 days, and I would imagine that's thanks in large part to her relationship with her primary care doctor and the relationship that her doctor has with other Prevea doctors. So that prevented a potentially way bigger issue for that patient and their family. Which brings us to our final and arguably the most important pillar, that primary care is selfless. No matter your age, gender, race, or ethnicity, checking in on your health with a primary care doctor will always give your family and your loved ones that peace of mind they deserve. So I'd love to also get both of your perspectives on this one, and Erin, I can throw it to you first. To you, how do you see primary care as a gift for your loved ones?
So I think it's when we coordinate care, I'm looking out for the well-being for myself, for my family. And that's where it's going to start in primary care. Make sure that I know they're in good hands too. My kids are the most important pieces of my life. So it's really important that they're seeing a provider that understands their specific needs. And that's what really primary care gives us, the child checks and the exams that we need. And that's really important to me. I sleep better at night knowing my kids are taken care of, knowing that my husband's taken care of. But that's also when I'm making appointments is online. I'm doing that at night after they are in bed.
Absolutely. And I think a lot of maybe parents too that get busy, they know, yes, my kid needs to go to the pediatrician, but I need to be going to the doctor too to take care of me so that I'm there for my kids for sure.
Absolutely. Absolutely. Every child wants a happy, healthy mom or dad.
Yeah, for sure. And Dr. Nguyen, what about from your perspective? And also, would you maybe have any advice for a listener out there who might be like dragging their feet on making an appointment with a doctor?
I'm a little biased. As a family physician, I love seeing the entire family as a unit. So seeing kids, their wives, husbands, grandparents, and not only to get to know the family themselves, but it also helps me get a better idea of their family history. I almost feel like sometimes I act as their secretary because then I can keep a note on maybe grandpa had a colon cancer or had a diagnosis that maybe later on I can then relay back to their grandkids. So it helps kind of take off some of that burden and pressure on the patient, the parents, because we can document all of that and it's all there readily available. But for the patients who are hesitant, I get this quite a bit. They are always worried that we're there to give bad news, but it's less likely for us to give bad news if you're coming to see us more frequently, because then we can manage things as they come rather than waiting till the very end when it's a little bit more difficult to manage when there's a new diagnosis that we have to give you.
And with that, thank you both so much for joining us today and sharing the importance of routine primary care. As you said, not waiting till you're sick or seriously unwell to get to the doctor, and really giving you and your family that peace of mind that you will stay well. As a reminder, the 5 pillars are: primary care is easy, quick, preventative, your quarterback, and selfless. Is there anything else that either of you would like to add?
If you're ready to schedule online, go to Prevea.com, go take a look at our providers, or at any time, feel free to call our main number. We have staff that are happy and ready to help, 920-496-4700.
Awesome, thank you. And if maybe you're not ready to schedule an appointment yet, but you would like to learn more, as Erin said, please feel free to visit our Prevea Primary Care webpage. We have a lot of resources and information on there, and that website is www.prevea.com/primarycare. Thank you all so much for listening.
You've been listening to Plug Into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at prevea.com. Thank you for choosing to plug into health with Prevea Health.